Hello everyone, I hope so. You will be fine. My name is Dr. Abid and I welcome to all of you in GS Score. As you know that we are continuously giving to you a different kind of questions and we are giving the best way to understand the question. And during this session, we try to discuss and we try to highlight and we try to understand how to understand the question before writing the answer. And how to break down, how to decode, and how to identify the concept behind the question. So today, from the Environment and Ecology GS Paper 3rd, we will discuss Global Air Quality Guidelines, World Health Organization. It is very, very important. And the question is that from the 2021, describe the key points of the revised Global Air Quality Guidelines recently released by WHO. How are these different from its last update in 2005? What changes in India's National Clean Air Program are required to achieve revised standard? You know that. Question is sufficient. Question is very long and very conceptual. Question has a very depth and question required some kind of specific knowledge related to the current affair. Means you have to be very clever. And before writing the answer, just we have to understand how many parts are in this question. We have to understand. Okay. Now let's move and let's break down the question. And what are the concepts behind the question? Here are the breakdown of the questions into 3 parts. Okay. So we will discuss and we will try to understand the question through 3 parts. Number 1. Describe the key points of the revised Global Air Quality Guidelines. As you know that the first part is directly indicating toward the Global Air Quality Guidelines. Barabar? So means what are the directives and what are the focuses? इस लाइन में ये हमें समझना है. So means whenever we'll talk about the Global Air Quality Guidelines, means we have to describe, list and briefly explain. Next one, we have to focus on World Health Organization's Global Air Quality Guidelines, which is very important for pollutant covered, new threshold values and rationing. Okay, this is the first part of the question. Now let's move toward the part number 2. How are these different from the last update in 2005? Getting my points? So the question is talking about how are these different from its last update in 2005. So whenever we talk about this part, we have to focus on directives and focus. Means how are these different requires a comparison of 2021 versus 2005 guidelines. Means 2005 guidelines and 2021 guidelines we have to compare. Next one, whenever we talk about the comparison between 2021 and 2005, means you have to focus on what kind of changes has been we focused and we occurred over there. Getting my points? Now let's move part 3. What changes in India's National Clean Air Program are required to achieve revised standard? Okay. So the third part of the question is talking about National Clean Air Program are required to achieve revised standard. Means you have to link these 2 points with third points. And whenever we talk about India's National Clean Air Program are required to achieve revised standards, so basically you have to focus on what kind of changes are required, calls for evolution and suggestions. Number 1. Next one, you know that National Clean Air Program plus proposed policy and implementation reform to meet WHO 2021 targets. Means what kind of guidelines right now we have, क्या हम भी WHO की guidelines को follow कर रहे हैं with the help of different kind of schemes, policies, treaties and programs. Now let's move the second phase of the question. These are the important keywords. With the help of these all keywords, we can easily identify the beautiful answer. You know that WHO, AQG and 2021, this is the prime things in the question, and whenever we talk about these prime things, so ये मत भूलना कि साथ में ये PM 2.5, 10 एंड NO2, O3, SO2 ऐसी बहुत सारी गैसेस के बारे में बात वो करेगा, इवन यही क्यों ना हो. एंड यू विल फाइंड आउट देयर, जब ये सारी चीजें हो रही हैं तो डेफिनेटली वी हैव टू टॉक अबाउट एयर पॉल्यूशन. Whenever we talk about air pollution, so we have to think about the health impact and environmental impact. Next word, National Clean Air Program, Policy Alignment and Gaps, Sustainable Development and Environmental Governance. These all are the keywords which you have to mention in your beautiful answer. ठीक है, बात समझ में आ रही है? Now let's move toward the model answer. So as you know that we start our answer from the introduction, and we have three parts of the answer. The first, introduction, second is main body, and third one is conclusion. So you'll find out there we are starting our answer from the introduction, and 2021. WHO updated its global air quality guidelines after 16 years. Getting the points? These guidelines aim to provide scientifically backed threshold for clean air pollutant that pose risk human health. The revision reflects growing evidence that even a low level of air pollution can cause serious health effects. So you know that I finished my introduction just in 3 lines, almost 3 lines, and now you will understand I started my answer from the WHO updated its global air quality guidelines after 16 years. I'm not saying for 2005 and to 2021, I'm saying after 16 years. And next I discuss AIM. What is AIM? To provide scientifically backed threshold for key air pollutant. And last one, you will find out that revision reflect growing evidence that even low level of air pollution can cause a serious health effect. In the last line, I mentioned the causes and effects of the air pollution. चाहे वो थोड़ा सा ही क्यों ना हो. So now you can understand that just in 3 lines, I am expressing the maximum information regarding the WHO and its global air quality guidelines. Now let's move toward the main body. These all are the main bodies, key highlights of 2021 guidelines. ठीक? So you find out there the new guidelines propose stricter limits. This is the important word that was the reason I highlighted it. You have to do on major air pollutant, including fine and coarse particulate matter, ground level ozone, nitrogen oxide, sulfur dioxide, and carbon monoxide. These all are the important pollutant, very serious and harmful gases for humanities. Next one, the recommended safe level for fine particulate matter, okay, has been reduced significantly. ऐसा इस दावा, ऐसा रिपोर्ट में कहा गया है. The guidelines emphasize health equity, particularly for children, the elderly, and low level income population most vulnerable to air pollution. Means I highlighted health equity. What is health equity? Means for children, for elderly, for low income population most vulnerable to air pollution. ये बात हमने डिस्कस की है. In last line, WHO has introduced interim target to help countries transition gradually toward the ideal standard. So basically, whenever we discuss the highlights of the 2021 guidelines, I mentioned the 4 important lines: stricter limits, है ना? Then I discussed the greenhouse gases or the most discussed pollutant. In third line, I discussed health equity because ये health को बहुत बड़ा issue है वाला. And then in the last one, I discussed its target. What kind of targets right now they have. So you will find out there in 4 lines, I mentioned 4 different things. क्या मैंने इसमें नया किया? I avoided the repetition of words. I avoided the criticism of the guidelines. I avoided the extreme views. I avoided the bulk of words, जो फालतू के words होते हैं जो भर देते हम. And I avoided my opinion. I just mentioned the guidelines here in my own words. Difference from 2005 guidelines क्या है? Now you will understand that The earlier standard were more lenient and based on limited data. Number one. The revised guidelines are based on stronger epidemiological evidence and call for much lower pollution level for the same pollutant. The shift represents a more health-centered approach rather than just environmental control. So I mentioned just 3 lines, ठीक है, difference from 2005, मैंने 2021 वाले में लिया है. I started my things from earlier standard were more lenient and based on limited data. Number one. You will find out that in second line, I revised guidelines are based on stronger epidemiological evidence and call for much lower pollution level. Now, I discuss the conditions of the pollution and pollutant. In last one, you will find out that I focused on health-centric approach. यहाँ पर ही दिख जाता है rather than just control the environment. ये सारी चीजें थी. Now, second part is that, मतलब third part is that, ठीक है, National Clean Air Program. What I added in that part, India's current program target 20 to 30% of reduction pollution by 2024. ये हमारा target था, ये मैंने लिखा. The aligned with WHO new norms, India must raise its target, expand air quality monitoring, and force stricter emission norms across sectors like transport, industry, and power. You know that in the second part, I mentioned that what kind of activities should do, okay, India to attach to align with WHO's new norms. ये मैंने इसमें दिया. Public awareness, local level planning and investment in clean technologies are essentials. So आप इसको दूसरी तरह से भी लिख सकते हैं, ठीक है, different kind of way. So generally, I discussed just 3 lines about the National Clean Air Program. Okay. Now, I move toward the conclusion. I have only almost 2 lines conclusion. So with the help of 2 lines, just let's find what is the input in these 2 lines. Align with WHO, so revised air quality norms, will not only improve public health outcomes but also reinforce India's commitment to sustainable development. In the 1.5 line, I discussed the WHO's revised air quality guidelines on norms and I focused on improved public health outcomes. And you know that in the second line, I started my view about the India's commitment to sustainable development. Ye hai point. And last one, recalibrated NCAP is vital to meet this global benchmark. मैंने उसकी तारीफें कर दी हैं. मैंने उसकी तारीफें कर दी हैं last में. So now, ठीक है, this is the perfect answer for the question. With the help of these all limited areas, you can get the maximum marks if you have. You know that you have to work and you have to do practice regularly to get the maximum marks and to write the beautiful answer. Now I have a surprise to all of you. Probable questions. Now these are the 5 questions and regarding the pollution from urban, from India's National Clean Air Program, health impact. These all questions have different kind of impact and the definitions. I hope so. You will try to write, you will try to solve these all questions, and when you will write these all questions, then you have to submit the answers in given below link. Then I will tell you what are the key positive points and what are the negative points आपने जो चुना है इसमें. Getting my points? And now, ठीक है, we मतलब क्या कह सकते हैं? Thank you so much. So this is enough from this side. See you soon with a new question. Take care.